Over the next 5 years, we need to recruit more people than currently work in this field. That's a very, very tall order.
The San Diego Workforce Partnership's chief economist, Daniel Ennemark, helped prepare the behavioral health report that he calls one of a kind. It included surveying some 1,600 behavioral health workers and students. Results found that the majority of jobs are underpaying.
This is a problem. We can't recruit and retain people if we aren't paying them.
The Workforce Partnership presented their findings to local providers during a recent behavioral health symposium. Officials estimate between the private, public, and nonprofit sector, there's currently 17,000 behavioral health workers to serve a county of more than 3 million.
The current workforce is meeting a lot of the behavioral health need, but not all of it.
According to the partnership, to meet the growing need and replace people leaving the field, about 18,000 more workers need to be hired in the San Diego region over the next 5 years. That includes everything from peer support specialists to counselors, social workers, psychiatrists, and other hospital staff.
I would say nowhere in America has built out the system of behavioral health care to provide the right care to the right person at the right time. And I want San Diego to be the first.
Chairman of the San Diego County Board of Supervisors, Nathan Fletcher, commissioned this study. He says no one entity can fix this gap overnight, but many have to chip in.
We're hoping to not only leverage our friends in philanthropy, to have the county join, to have the state join. We'll be going to Washington, D.C. to advocate for funding there, because we've got to develop a system that gets the right person, the right care at the right time. And the investing in people and in the workforce is a vital component.
The county has been doing more in recent years. The last 4 budget cycles have resulted in a total $230 million increase in behavioral health services, with the overall budget now approaching $900 million. For Fletcher, this issue is personal. He says he had a turbulent and traumatic childhood, then as a Marine had multiple combat deployments.
Watch the impact of combat weigh not just on me, but on my friends, and I know how serious that is. But the reality of trauma is it's not just Marines and Navy SEALs in war who go through this. Trauma is trauma. You know, anyone who survived a sexual assault, anyone who's been in a difficult situation could be experiencing that.
The county issues contracts to local nonprofits who then provide behavioral health services in the region, but some argue that system is outdated and doesn't keep pace with rising costs of living.
Right now, the county is allowing us to do hire-on bonuses, but we also need to do retention bonuses. We need to be able to reward the staff who have stuck with us, especially during the pandemic.
Catherine Nicario is CEO of San Diego's chapter of the National Alliance on Mental Illness, or NAMI. They work with up to 40,000 San Diegans each year. Nicario says some of her staff are leaving the field because of burnout.
Individuals are also leaving for higher paying jobs within the same industry. Since there is such a workforce shortage, what we're seeing happening is folks are leaving for $1 or $2 more an hour and literally giving no notice, like saying, hey, today's my last day. I'm going to go work for so-and-so and I start tomorrow.
The Workforce Partnership estimates the price tag for hiring and training 18,000 additional workers would be around $424 million. They're recommending a down payment strategy. It calls for investing about a third of that to bring on thousands of workers over the next 5 to 10 years. Nicario is part of the steering committee that aims to put these goals into action.
This is truly where the work does begin. We don't want this to go up on a shelf and gather dust. So we have to get a core group of individuals together that over the next 2, 3, 5, 7 years can make sure this is continuing to be pushed forward.
The Workforce Partnership also recommends developing a regional training hub to help create a steady pipeline of behavioral health workers.
Thanks so much for watching KPBS on YouTube. I'm health reporter Matt Hoffman. If you like what you saw and you want some more content, click that subscribe button.